Hello and welcome to this geriatric podcast on cognitive impairment. My name is Mohammad Farid Jabir. This is part one of a two-part series on cognitive impairment, and in this podcast we'll be primarily looking at the differential diagnosis of cognitive impairment, dementia, the different types of dementia, going into detail about the establishing a diagnosis and the criteria for fulfillment of dementia, and a brief discussion about Alzheimer's disease. Starting off with dementia, with cognitive impairment, it is a change in how a person thinks, reacts to emotions, or behaves. Most common differential diagnosis in older adults of an acquired cognitive impairment include three major categories of dementia, delirium, and depression, which is a temporary and a reversible cause of pseudodementia. Dementia is a big topic in the elderly population. If you work on a geriatric ward, it is a common diagnosis that you will come across with the patients. There are over 820,000 people currently living with dementia in the UK, and that number is forecast to rise with Britain's aging population. 1 in every 3 people aged over 65 will die with a form of dementia. It is an acquired global impairment of higher cortical functions, including both long and short-term memory. It is often progressive, though not necessarily irreversible. Criteria for fulfillment of dementia involves impairment in abstract thinking, judgment, as well as disturbances of higher cortical functions such as agnosia and visuospatial difficulties. Personality changes might be present. There might be memory impairment and intellectual impairment, which causes social and occupational impairments. Note that all of the above conditions should be in the absence of clouding consciousness. Going on to discuss about the different types of dementia, there are over 70, which each having a particular pattern of decline as well as underlying histopathological process. Alzheimer's disease, which accounts for 65% of cases, is the majority. The rest account for 10% of cases, that is vascular dementia, mixed vascular and Alzheimer's, dementia with Lewy bodies, and frontotemporal dementia. With regards to diagnosis, history is the key. Collateral witnesses, commonly family members, would give a good history involving dementia. Patients who suffer from Alzheimer's disease would complain of memory problems over a period of few years, which is quite gradual. If there's a steep decline over a short period of time with issues with mobility, vascular dementia should be suspected. And if there are any behavior problems such as irritability and apathy, frontotemporal dementia should be suspected. Lewy body dementia would come across with memory problems along with hallucinations and Parkinsonism symptoms. Going on to discuss briefly about Alzheimer's disease, there is no single clinical test or unique biomarker to identify Alzheimer's disease. Diagnosis made by way of comprehensive history in conjunction with neurological and mental status assessment. Imaging by way of CT scan would demonstrate cerebral atrophy. A common EMQ question would always have the stem involving beta amyloid plaques and neurofibrillary tangles. Basically, the neurohistopathological process underlying Alzheimer's disease is the presence of these beta amyloid plaques, which are proteins deposited between neurons, causing synapses to be gummed up, unable to transmit or receive messages. And the following are the commonest memory problems, commonest symptoms patients would complain of. That is word finding difficulties, difficulty with names, geographic disorientations, for instance getting lost at a mall or finding themselves lost in the neighborhood, disinterest in surroundings, sleep disturbance, and behavioral changes. Going on to potential reversible dementias, there are a number of conditions that may rarely mimic dementia and are reversible if identified and appropriately treated. Delirium is an acute confusional state, and there are many causes for delirium. Depression, also known as pseudodementia, electrolyte disorders such as hyponatremia and hypercalcemia can lead to this condition. Vitamin deficiencies, including B12 and folate, and medications such as sedatives, anticonvulsants, antihypertensives, and anticholinergics are common for reversible causes. That's about it for this podcast. Thank you for listening, and goodbye.